Yeah, well, it's really lovely to be able to meet you all today. I was really happy to be able to come in today and to talk a little bit about a really important issue which I think sometimes can be missed a little bit with cancer, which is the psychological and emotional impact of ovarian cancer. So in terms of what I was hoping to cover today, I guess I had a couple of things in mind that I thought it might be useful to have a chance to discuss and talk about. So first and foremost, to have a chance to actually talk about common experiences in terms of the emotional impact of cancer and be able to give a voice to some of those experiences. And in particular, talk about some of the really common issues that women who use our service tell us that they go through, one of which is feeling really alone emotionally. And hopefully then we can drill down a little bit and talk a bit more specifically about two of those really common issues, which is fear of cancer recurrence and how to find hope and cope with hope. And hopefully in talking about those two, we'll be able to come in and talk about some of the strategies that can be helpful in coping with these issues. And of course, with it only being a 40-minute presentation, there probably won't be time to impart too much yogi wisdom, of which I don't really have any anyway. But hopefully it can be a bit of a starting point. You might find that there's something that sounds interesting that can be a bit of a trigger for you to go away and do some of your own research or get some support as well. So I'd really encourage you to, if you have something to say, please put your hand up and take part. It'll make me feel a lot less lonely standing up here by myself. And it'd be great to hear the insight from people who are living with ovarian cancer and the ways that you find most helpful to cope. So, when I've spoken to women in general about their experience of cancer diagnosis and treatment and survivorship, there's often a really common theme that comes out when women talk about that experience, which is the sense of kind of having the proverbial rug completely ripped out from underneath you, which I think really makes a lot of sense when you think about it, because most of us go through life with a general sense of safety, and I think that safety comes from a number of assumptions that we make and that we rest on without realizing that we're making those assumptions. So we make assumptions about who we are as people, we make assumptions about what our future is going to hold, we make assumptions about the lifestyle that we want to lead. And in one fell swoop, ovarian cancer can really come in and cut away all of those assumptions all at the same time. And so suddenly what you're left with is this sense of spinning and this sense of being out of control and not grounded and having to rebuild from scratch. And so ovarian cancer really is a fundamental threat to the assumptions on which we base our lives, because it's a threat to survival, it's a threat to lifestyle, and the activities that you do that give meaning to your life. And even more fundamentally than that, it's a threat to your sense of self, your identity as a woman, as a human being, as a worker as well, all shift in really fundamental ways. And so I think, given that, it's really not a surprise then that the impact of receiving an ovarian cancer diagnosis and going through treatment often results in really significant consequences in terms of mental health and how you cope emotionally. And this is really just a list that we've compiled, not from ourselves, but just based on the most common concerns of women who access our service. So most commonly what people come to us with are issues like loss and grief, recognition of your own mortality, a sense of vulnerability and that loss of that sense of safety we were talking about, fear of recurrence, which we can hopefully go in and talk a little bit more about soon, uncertainty about the future, intrusive thoughts. Impact on sexuality is a really big one, not just in terms of the physical impact on the body, but the flow-on effect that can have for women's sense of femininity, sense of selves and their relationships as well. And of course, all of that's underpinned by losses or changes in your sense of identity as well. And these are just a couple of quotes from women who are living with cancer. So if I'm getting better, then why do I feel so sad? And I know I should be grateful, but I get so angry at times. I can't believe that I can't have a baby. And the reason that we kind of chose those quotes is because I think that it exemplifies a bit of a cultural problem that we have in terms of how we treat cancer, which is this overarching sense of pressure that many women feel to stay positive all the time. And for some people, it can almost feel like it's a bit of a sin if you start to experience any of these impacts. And I think that's a real issue, because while we're all on the outward side talking about being strong, being inspirational, being positive and hopeful, underneath there can be a real struggle and real emotional pain. And I think that cultural issue can leave a lot of women feeling alone in their experience as well. And so if you take nothing else from this presentation, and all of the strategies seem like utter crap, hopefully you can at least take from it the fact that these issues are extremely common. And that if this is something that resonates for you and that you recognise within yourself, to know that you're standing shoulder to shoulder with all of the other women who are also experiencing this. So I wanted to kind of drill down a bit and talk more about possibly one of the most common issues that women present with at our service, which is fear of cancer recurrence. So fear either of cancer coming back or cancer progressing further. And these are just a few, again, quotes from women describing their experience of fear of recurrence. So every time I feel a pain, my brain automatically presses the cancer button. It's like walking through life with this little black cloud on top of me, and I think one day it's going to rain on me, which I think does a much better job than I ever could of capturing that experience of trying to walk and trying to go about your life and trying to make plans, but always with this thing hanging over your head where you don't know where it's going to be pulled out from under you again. And so when you think about trying to approach something, I think personally I'm kind of a logical person, so I always kind of want to understand how something ticks as a first step. And so I think maybe it would be helpful to talk a bit about some of the processes that underlie fear of cancer recurrence and kind of fan the flames of those worries. And so there are a few processes that it can help to be aware of. And the first one is personal triggers. So these are things that happen in your outside environment that then trigger worries about the cancer. So it might be somebody asking you about how your treatment is going unbidden while you're just trying to drop the kids off at school, for example. Or really commonly, it can be follow-up tests and appointments. So I think Kristen actually mentioned that. So I think it's almost a universal experience. You know, for a lot of women, anxiety follows a bit of a cyclical pattern. You know, it'll build and build and build before an appointment, and then there's the horrible limbo of waiting for results where it's kind of at its peak. And then if things are looking good, there's a sense of relief for a period of time, but then it starts to build again. And one of the things that feeds into that cycle is the process of hypervigilance. So hypervigilance is a bit of a downward spiral kind of effect. So it's where you already have a bit of a niggling worry about the cancer, and because of that worry, you might become more aware of your body or of things in your environment than you usually would be. And so symptoms which previously you might not even have noticed or might have just been dismissed, like a bellyache, for example, suddenly take on a whole lot more meaning than that. And they suddenly become signs that the cancer could be back or could be progressing or that there's a problem. And then that anxiety in itself feeds into even more awareness of your body. And before you know it, you're completely lost from the present moment and you're just focused on trying to scan through your body to see if there's anything going on. And so those two processes together kind of come together and can trigger intrusive thoughts. So thoughts that then jump into your mind unbidden, that you don't necessarily want to be there and that can feel really awful and that you don't necessarily feel in control of. And different ways of responding to those thoughts can really fan the flames of those worries and feed into that process even more. And so two of the processes that can really feed into intrusive thoughts are kind of two extreme ends of a spectrum. So the first one is rumination. So that's the experience of really falling into and fusing into a thought. So where you have a thought about, is this a sign that the cancer's coming back? And then you fall into that thought, lose touch with the present moment, and before you know it, you're going through all of these future scenarios, cycling through what it's going to look like, imagining it all in detail. And so that process of rumination kind of means that the worries are feeding into each other and get caught in a spiral kind of pattern, which obviously isn't helpful and kind of maintains the whole process. But I kind of wanted to talk as well about the other end of the spectrum, which is probably a more common strategy that a lot of the women that I talk to at least try and use to cope with these worries, which is avoidance. So this is where if a thought comes in, there's automatically that sense of tension that comes in your body when you notice it, and that sense of panic about the thought. You might think, oh, this is an awful thought to have. This means that I'm losing control of my mind. I'm trying so hard to get rid of it. And then there's this kind of battle with the thought that ensues where you're trying to push it away and push it out of your mind. And I guess the idea that I kind of wanted to talk about was that either end of that spectrum, both rumination and getting completely caught up in the thought, and also avoidance, actually both end up feeding into anxiety. Because the thing about avoidance is that it's not really possible to get rid of a thought. So it's kind of like taking a beach ball in the ocean and trying to push it down under the water. You know, you might get there for a little while at a lot of cost of water in your mouth and splashing around, but eventually that ball's going to pop back up and maybe hit you in the face on the way. And the other reason that avoidance can be really problematic is that when those thoughts come in, it's almost like putting an extra layer of suffering on top of it. Because not only then do you have the anxiety about the cancer coming back, but then you've got anxiety about having the thought. And there's that sense of losing control of your mind that I think can come when you try and push that beach ball down and it pops up again. So I'm not sure, this may or may not be striking a chord with you, but it's definitely, these are some really consistent themes that come up for me and for the women that I talk to. So it's no worries at all if you don't want to participate, but for anyone who's wanting to do a fun activity, there's a classic old exercise that kind of demonstrates this idea, which is called the white bear exercise. So if you just bear with me. See, I tested that joke at home, and they told me not to say it because it was lame, but I was right. So if you want to come with me and really stare at that picture of a bear for a few moments and fill your mind as much as possible with thoughts of a white bear. So really imagine how it looks, imagine the texture of its fur, imagine its eyes and its nose, the sounds it's making, its size. Fill your mind with a white bear as much as you can. And now what I'd like you to do is completely banish all thoughts of white bear from your mind. So keep looking at the picture, but you're not allowed to think of a white bear, and if you do, that's a really big problem. That's something to panic about. That's a real issue. So how's everyone going with that? No, yeah. So hopefully that kind of illustrates this idea. All right, so the process of trying not to think about a white bear while you're staring at a picture of a white bear, to me is roughly analogous to the process of trying not to think about cancer while you've got a bunch of follow-up appointments that you're trying to manage at the same time. It's just not something that's possible, and to try actually creates this sense of loss of control, which can be really distressing. So if rumination doesn't work and avoidance doesn't work, what do you do, right? So I think that what can be helpful, our service has found, is to take a bit of a middle approach. And this is where we've found that mindfulness can really be a helpful approach to managing difficult thoughts and worries. So mindfulness is about opening up to difficult thoughts and feelings, not trying to push them away, but at the same time, not becoming caught up in those thoughts and not ruminating. So it's about allowing the thoughts and feelings to come, but also allowing those thoughts and feelings to go. And to do that from a space of observation, so that there's not that sense of panic and feeling out of control. And so there probably isn't time enough today for me to give you a full rundown of this thousands years old tradition, but I'll give you a bit of a taster, and if you find that it's interesting, it might be worthwhile looking it up because it's really an exploding area. There's lots of resources out there if you're interested. So to use mindfulness to manage intrusive thoughts and fear of cancer recurrence, you can think of it as sort of a multi-step process of trying to find a balance between acknowledging but not getting caught up. So say when the thought first comes in that, this could be a sign that the cancer's coming back. The first step would be actually a step backwards. So you'll probably notice initially when that thought comes a sense of panic straight away and tension in your body. So the key is, rather than going and continuing down that spiral, to actually take a step back, take a breath if you need to, and notice what's happening and label what's happening, which, with a bit of practice, does a better job of putting you back in the driving seat over those thoughts. So sometimes it's even helpful to say to yourself, okay, what's here? I'm noticing that there's a thought about the future. I'm noticing there's a thought about that scan result that's coming up soon. And you can do the same with your feelings. So tuning into the body, and rather than panicking about all the tension, breaking it down for yourself and say, oh, what's going on here? There's a bit of tension in my belly. I can feel some tension in my jaw. I think this is anxiety. So there's a thought here, and there's also anxiety. And just the process of taking that step back helps you not to engage with the thought, but you're also not getting into a battle with it. And the next step then is to have a think and recognize whether this thought is something that's helpful to engage with. So some worries are actually super helpful. So if you're having a thought about, oh, this appointment's coming up, but it's going to conflict with that, that's a very helpful worry to have, because then you can call up and reschedule. That's something practical that you can get some control over and do something about. The thoughts about cancer recurrence and what's going to happen in the future that's out of your control is probably a less helpful thing to engage with and fall into. And so you say, okay, so there's a thought here about what my scan results are going to be. I don't think that this is a helpful spiral for me to go down with, for me to really engage with this thought right now, because there's nothing that I can really do about it at the moment. And then the next step is to practice a process of acceptance with thoughts and feelings. And so when I say acceptance, I'm definitely not meaning that you have to like it. So nobody that I've ever met on this green earth has ever enjoyed having intrusive thoughts. So rather than liking it, acceptance is more about just acknowledging the reality of it. So acknowledging that it's there. And then the second part of acceptance is also acknowledging that whatever your experience is, it's going to be temporary. And that can be a really powerful way to ride out anxiety, is to remind yourself that always in your experience so far, as with all emotions and all experiences, that worry is going to come, and then it's going to pass away eventually. And sometimes it can even help to imagine it as a bit of a wave in the ocean, which emotions follow a very similar process. You know, you can see it building, and then eventually it really becomes a big wave. Eventually it hits a peak, and then it breaks and it subsides. And so it can really help to remind yourself that I'm in the ocean, there's a wave coming, there's no point trying to face it, put my face into it, there's no point trying to hold it back. But maybe I can just kick my feet a little bit, keep my head above the water, and wait for it to pass. And then the final step is to have something that you can do where you can anchor your attention in the present moment while you're waiting for it to pass, so that you don't get hooked into it. So this is where mindful practice can really come in, and meditation can be a really helpful skill to cultivate, to learn to focus in your attention and anchor it in the present moment. And so for me personally, the grounding technique that I use the most to try and stay present and to stay focused is to focus on the breath. Personally, I think that this can be a really powerful one because it's portable. You can take it anywhere, including the podium when you're giving a presentation. And it's also fundamental to our bodies. So it's fundamental to our physicality and our life, and it's something that will always be there to anchor you. And so focusing on the breath doesn't mean that you have to do anything fancy to try and change the way you're breathing. It can even just be tuning in and noticing the details of each one. So noticing that as you breathe in, your body's expanding, and as you breathe out, your body's contracting and releasing and letting go. And you can focus on one breath as well. So from the tip of your nose as you breathe in, down to the belly, and then out again. And that's a really helpful thing to do when you first get that thought and there's that initial panic, to do that and then go through this process of trying to take a step back. And you might have to do it several times, because thoughts are pretty sticky, they'll try and suck you in. So it's just that process of gently bringing yourself back again and again. And I like the breath, but it doesn't really matter what you choose to focus on. So some people like to focus on sounds, some people like to press their feet into the floor. If you look up out there, there's lots of examples of grounding strategies that you can find. But it's about just finding something that can anchor you to the present moment. So I guess the other main thing that I wanted to have a little bit of a chat about is the role of hope. So it's pretty common that I talk to women living with ovarian cancer, and there can be a really consistent theme of women saying, well, why can't I just be positive? You know, everybody is telling me that I need to be positive, I need to be hopeful. What's wrong with me that I can't be hopeful? And so I wanted to hopefully take a bit of time to have a bit of chat about that today. So hope is really, it's an expectation and a desire for something to happen in the future. And I guess the point that I wanted to make is that hope, far from being sort of this universally needed thing when you're going through cancer, is actually a bit of a double-edged sword. Because if you're feeling genuinely hopeful and you're feeling genuinely positive about things, that's fantastic. It's got so many benefits because it can reduce anxiety, it can help to motivate you to make helpful strategies and choices. But on the other hand, trying to force yourself to feel hopeful, if you're just not there, if you've got other complex feelings that are there at the same time, can cause a lot of problems if what you're having is a sense of pressure on yourself and self-criticism. And it can also be unhelpful if it means that your mind is forever locked in the future, trying to force yourself to feel positive about your test results, rather than being in the present moment within your own sphere of control. Because again, that's taking your mind out of what you can control and putting it into what you can't control. And so this really comes down to what we kind of call the tyranny of positive thinking, which I think is this really pervasive myth that's out there in the world of cancer, that in order to cope well with cancer, you basically have to cut in half the whole spectrum of human emotion, and you're only allowed to feel this half. So not allowed to feel afraid, not allowed to feel sad, you're not allowed to grieve over the losses that you've had in your life. You can only be positive, forward-looking, strong, brave, thinking about the future. And I guess what I wanted to kind of suggest is that there's an alternative out there to positive thinking, which is helpful thinking. So rather than positive thinking, helpful thinking is about taking a balanced view of the situation. So it's possible to focus on the positives and to give yourself some really nice encouragement and compassion and kindness without feeling like you have to cut off that whole spectrum of feelings and be positive all the time. And so helpful thinking is about developing ways of talking to yourself that are balanced and believable. So ways that acknowledge the positives of the situation, acknowledge what you're grateful for, ways that give yourself coaching and encouragement, but at the same time, you're not ignoring the reality of the situation and you're not trying to tell yourself that you need to feel something that you're just not feeling. And so you can imagine helpful thinking as kind of being like a really great coach or mentor on your shoulder, telling you things that are true. The coach isn't living with his head in the clouds, but they want to help you through it and they want to give you encouragement. So the first step to cultivating helpful thinking is really to become aware when thoughts are unhelpful or problematic, so that you can take a step back from them and develop a new way of approaching that situation. So there are lots of resources out there online and other places where you can actually practice recording and learning to observe and recognize your thoughts. And I personally think that it's a really worthwhile exercise to do if you feel like you've got the mental space to be able to do it for a while, just to become aware of how we're talking to ourselves and the way that we talk to ourselves can influence how we feel and how we behave. And it can be a good exercise as well, once you've got the idea of some of the common thoughts that you're going through with yourself, to write that down on a bit of paper and to ask yourself a series of questions to be able to get a bit of distance and to think about the impact that that thought's having for you. So it can be helpful to look at what errors might I be making in this thought. Maybe it's not just a fact. Maybe this thought is actually influenced by my past experience and my emotions and how tired I'm feeling from the treatment as well. Am I ignoring or missing part of the picture? You know, our brains are like Velcro for negative stuff and like Teflon for positive stuff. So it's very easy for us to have a bit of a negative bias. This is a good one. Is it helping me to think in this way? So what's the impact of this thought on you? Is it coaching you? Is it encouraging you? Or is it getting you down and dragging you? And is this how I would speak to a loved one? So is this how, if someone that I loved was going through this experience, is this how I would want to relate to them and talk to them and encourage them through it? And then I guess the final step is to think about, is there an alternative way that I could look at this situation? So is there another way that I could talk to myself which might be a little bit more helpful and a little bit more encouraging? So just as a couple of examples, here are some really common unhelpful thoughts that we hear about all the time, and some alternative ways of looking at that same situation. So a really common thought is around self-blame and guilt. So I'm stupid and hopeless for feeling upset, I shouldn't be feeling this way, I should get onto it, I guess I should get on with it, I should go back to normal. A more helpful way of approaching that thought is to say it's actually normal to feel upset. It's not a sign of weakness, so to validate your own feelings and say that it's part of a normal reaction to a really stressful and difficult situation. The what if thoughts are really common. So what if now I've finished treatment, I'm worried the cancer will come back. Sometimes it can help to focus back on the positives and focus back on the present moment as well. So say, I'm not going to worry now about something that hasn't happened yet. I feel well now and I'll take it one day at a time. Puts things back within your own locus of control and influence. Another common one is catastrophizing, where, I don't know, this is a big one for me, your mind automatically jumps to the worst possible case scenario. So very common, people going through treatment, feeling really fatigued but really frustrated about not being able to get stuff done in the house. Saying everything is going to fall apart and be awful if I can't do everything in the house that I want to do. So rather than positive thinking, where you might be telling yourself, well, I just have to rally, I just have to get onto it, I can do it, I am going to get it all done. Helpful thinking is about taking a more balanced view. So being able to not do some things is frustrating, but I can cope with that frustration. And I can still do some things, and that's what I'm going to focus in on. So hopefully that kind of gives you a bit of a sense of the difference between helpful thinking versus positive thinking, and that you can coach yourself through it without feeling like you need to get really down on yourself and judge yourself if you do have moments of sadness and fear and worry. So that's just about it from me. But I wanted to just finish up by saying that if you found that there was anything today which kind of struck a chord with you, so if there were any strategies which kind of piqued your interest, or if there was anything we talked about at the beginning in terms of those common experiences which felt like it struck a chord and you've kind of been carrying it alone for a period of time, I would definitely encourage you to reach out for support, because there is support out there, and you can do that by going to your GP and talking to your GP about options for support, or if you prefer, we also have an in-house counselling service here at the Cancer Council, which is staffed by registered psychologists. It's for anyone in Queensland affected by cancer. It's available telephone, face-to-face in certain offices. And if you're particularly interested in mindfulness, we also run mindfulness groups. So 8-week skills-based courses to build skills in mindfulness if you're interested. So if you'd like to look into that a little bit further, you can always call 13 11 20, and they'll be able to get that process started and look at whether that service is an appropriate one for you. So yeah, in summary, thank you so much for having me, and it was lovely to be here.